Dr. Sana, Assalamu alaikum.
Salam.
Thank you so much for joining us, everyone. My name is Shanza Khan. I'm a stickler for time. I know here in Pakistan, people tend to join slightly late, but I want to open the opportunity, for the audience to really make the most of the expert guest we have here today, and therefore want to leave room for greater questions in our Q&A segment towards the end. This session is being recorded, so if you miss the first 10 minutes or 15 minutes of this session, if you are registered, we will make sure that you get a copy of the recording. With that, my name is Shanza Khan. I am the founder and CEO of Ion Ivy, and this is the second of our monthly webinar series where we bring in renowned experts from around the world to answer the pressing issues of the day. Our topic for today is AI and the future of medicine, and we are joined by none other than Dr. Sana Khan, a renowned radiologist, neurophysiologist, and researcher, teacher, and entrepreneur. He attended UC Irvine for his Bachelor of Science in Biological Sciences, then medical school at UCLA, where he graduated as a Dean Scholar with MD and PhD degrees in anatomy and clinical neuropsychology. He was the first radiologist in the United States with the stand-up weight-bearing MRI. I'm not a doctor, Dr. Sana, you'll have to explain to me afterwards what that is, and has contributed significantly to the advancement of this technology. Dr. Khan owns imaging centers throughout California and continues to be a prolific researcher with active projects at UC San Diego and USC, while also serving on the Dean's Leadership Council at UC Irvine School of Biological Sciences. His contributions to medicine have been recognized with numerous prestigious honors, including the U.S. Congressional Medal of Distinction for advancements of medical science in radiology, induction into the President's Circle of the Radiological Society of North America, and UC Irvine School of Biological Sciences Distinguished Alumni Awards. I don't even know where to begin, Dr. Sana, with so many accomplishments, but beyond your clinical and academic work, I have to add this on. Dr. Khan is a serial entrepreneur who has built diagnostic imaging centers nationally, earning recognition as an Earnest and Young Entrepreneur of the Year finalist in California, and the keys to the City of Houston awarded by Mayor Bill White for his financial and academic contributions to the city. Welcome so much, Dr. Khan, to this session. We are grateful to have you with us.
Alhamdulillah, thank you so much for the introduction. It's a little embarrassing. But it's a Allah ka fazal, honestly. It's not, we as humans can try and then God has his ways of opening doors. So alhamdulillah, it's all good.
Dr. Sana, I'm going to be asking you questions on different topics regarding the future of medicine, student preparation, and so on, and would really like your take in these particular areas. And regarding the future of medicine, if you were to go back and you were a high school student today, hoping to become a doctor, what would you do differently knowing how rapidly AI is changing healthcare?
Oh, wow. Okay, so now you're taking me back many, many years, Shanzai, and it's a long time ago. But I will tell you right now, I would, and keeping it succinct, I would tell you I would work on learning how to work with AI and data as much as I would be learning biology and chemistry. And in fact, recently, the medical schools in the United States, particularly the one that I'm very much affiliated with at UC Irvine, they're actually starting programs that are combining engineering degrees. So people graduating from high school, going into college, going to combine engineering and medical school programs, so that gives you an indication how much technology will be part of medicine in the future, near future. So I would tell you, you can learn biology, you can focus on chemistry, but just as much time you need to learn how to vibe with AI in utilizing this information.
No, thank you. Thank you for that insight, Dr. Khan. As I said, I know our audience is probably still joining in, but I think that's a very important takeaway for the educationists and counselors who are joining us today when they're guiding students. What medical specialities do you believe will be most transformed by AI over the next 10 to 15 years?
Yeah, I would even question. I would bring that year down to next 5 to 10 years, because of the rapid advancements in AI. So I can tell you that all of the medical specialties are going to be uh, affected by it. So AI will permeate every aspect of medicine, including psychiatry, by the way. I used to think that psychiatry was going to be exempt, but it seems now in our research, we find that people tend to be even more honest with with AI than they are with their own psychiatrists or psychologists. They tend to be more, they feel a lot less judged. So I think that the field of psychiatry is going to be affected. But to answer your question in a very straightforward way, obviously my field, which is radiology, is going to be tremendously affected, transformed. It already is. Pathology as well, primary care, ophthalmology. I think dermatology, anywhere where you can actually, in terms of cognitive load. Um, the more cognitive load a specialty has, the more vulnerable it will be to AI. So, as a radiologist, what I do is basically it's digital information and pattern recognition, right? So, uh, yeah, well, AI will do that just as well and potentially even better. That doesn't eliminate the radiologist, and I'll get into that a little bit later, I think, with you. But I think that it's very important for the radiologists and all physicians to understand how to utilize AI optimally in their specialties.
If I was to flip that question, Dr. Sana, which specialities are least likely to be impacted by AI? In that sense, I know you've said that the more cognitive it is, the more likely it is to be replaced by AI. But
Yeah.
we are going to be joined by some non-medical people today, including myself. So if you could elaborate on that, please.
Absolutely. So I'll tell you, sometimes people think that I'm talking, it's like hopeless and this, and that. Not at all. Okay. I think that there's going to be really a good role for physicians, but they should. And in fact, when we are recruiting medical students now, the thing is no longer that we're looking for the best score on the MCATs or the greatest GPA from the best medical school or undergraduate school. Now it's going to be much more about those that are empathetic, those that patients can trust, those that will actually sit there and hold the patient's hand. And instead of having to spend those 15 minutes in the room with the patient, typing away and trying to amass the data, analyze the data at the same time talking to the patient. The doctors of the future are going to have data available to them readily, already analyzed, and very much pretty much the game plan in place. But then you want to have people that are going to be communicating that to the patient with empathy, and the patients still will need that, the physician or their medical expert handholding, building trust with the patient, ethical judgments, right? That's still going to be human realm. And then shared decision making with the patient. That's still very uniquely human. So I think that, those qualities will be more important in admitting future medical students than of those that have possibly just the highest scores and the brainiacs and that have great memorization skills but don't have many good personal skills, because memorization skills essentially will be secondary to the power of AI in data and information retraction.
Understood. Um, So it kind of touched on the question, what aspects of medicine do you think AI will never be able to replace? So I guess touching on the empathy is
Yeah.
one. Are there any other aspects do you think AI will not be able to replace?
Um, Gosh, in terms of medicine,
Yes.
so I think that again, anything cognitive, it's going to enhance. Because when we use the term replace, we almost think that we're taking the human out of the loop. Okay. And I don't think that's necessarily going to be the case. I don't think, in fact, I think it's a bad idea to replace the humans. But what we do need to do is to make sure that the humans that are in this field are going to because the replacement would be of cognition, right? So, generally speaking, Shanze, we don't have a doctor that understands radiology, pathology, internal medicine, psychiatry, dermatology, everything. There's no one physician that can master all of these. Okay, whereas AI agents will master, a medical AI agent will have knowledge of all of these fields at one place at one time. So, humanly speaking, we're not going to be able to do that. So it will replace that aspect of it, except that the person that's there communicating and talking to the patient needs to actually understand what the outputs are from the AI and how to really deliver that to the patient. Somebody has terminal cancer. You really don't want an AI agent to be object, just say, boom, okay, this is what you got, right? Without the human part. So even if somebody has diabetes, somebody has, I don't know, malaria or whatever it is you want, you really want that communication to be very human. So we're not going to replace that part, but anything cognitive certainly will be available by AI.
Great. And going onwards then to student preparation as they go towards med school, you have said that engineering is going to be extremely important for students to learn as they're now moving towards medicine. So, should future doctors learn coding, data science, or AI alongside medicine? And if so, how much?
Okay, so answer your question, should I learn coding? Coding would be beneficial, but certainly not essential. That I don't think necessarily you have to sit there and make software engineers out of the doctors. But I believe that every physician should understand AI fundamentals and should have data literacy. So, yeah, we don't need to make them computer science PhDs by any means, but again, fundamentals should be in their grasp.
And what skills should high school students focus on developing today to remain competitive in the future health, healthcare landscape? Um, and if you could touch on a little bit on how much of the curriculum differences, Dr. Sana, you're very much embedded in the UC curriculum, especially. Are these skills being taught now in the pre-med medical pathway in America versus the system in
Yeah.
Pakistan remains as is with the focus on the core sciences with no integration of the AI and engineering you have mentioned? What should our question number one, what should our Pakistani students over here do in that case? Should they be taking these kind of courses in their spare time? Um, would
Wow.
really like to hear from you.
So you're serious about this? So your comment is a serious one in terms of the medical schools here are still the same as they were a few years ago?
Dr. Sana, the curriculum remains probably pretty much from what a generation ago in terms of having the three sciences, the biology, physics, and chemistry in the pre-med stream for your FSC going into med school. There is no integration of the engineering, AI, and so forth that we just discussed. I would like to know, number one, is that going on in the United States? And-
Yes. Number one answer is absolutely it's going on in the
Oh,
United States. The
okay.
entire curriculums are being revised, redone. I'm taking part in this. There's no question that without it, you will not be producing optimal physicians. No question about it.
So
Yeah.
in the unfortunate reality that our curriculums, particularly our pre-med curriculums, and that is the student body that I am primarily working with, remain the same unless, for example, you're one of the very few who are studying in the IB pathway or the American pathway, and those are literally numbers in the hundreds as compared to, the thousands of students in the FSC pathway. What should those students do today, Dr. Sana? What is your advice to them?
Okay. Wow. Okay. I will say that if that's the case and the students are not getting this as part of their curriculum, then they really need to start taking online AI courses. You need to start participating in science fairs, explore healthcare data sets, follow developments in digital health on your own. Um, I know that's a lot to ask, potentially outside of the classroom, but without it, um, really, I mean, you're just Shanzi, look, the reality of our world today, I always say this, but it used to be where the developed nations trajectories were like this. The developing nation trajectories were sort of on here, but still rising. But Shanzi, we're taking right now a vertical leap. So it's going to be an absolute vertical leap in terms of knowledge and how we're going to utilize it. And if you still have the traditional methodologies and you're still down here, you'll never catch up. So I don't know how to tell you this and to the students and the audience that are watching this. Um, the curriculum in Pakistan, somebody needs to shake up the people and say, you know, you really need to change the curriculum of medicine. Probably change the curriculum of most everything else too. Um, but certainly in medicine, you got to get more computer science in place. You got to get more statistics. You got to start teaching more ethics and ethical challenges that'll come with AI. And then I haven't even mentioned robotics to you just yet. You know, and the psychology, the economics, everything is going to change in the next few years.
Wow.
You're talking about 10 to 15 years, and I'm telling you, no more than five. Um, you know, so if Pakistan and the students need to keep up, and if you don't have it available in your traditional settings, then you have to go get it yourself. And then there are plenty of AI courses available online to do so, but um, there's no escaping it. I'm sorry. I'm being just very blunt. There's no way to avoid it, you know?
I, I think this is a really important takeaway, and it merits bringing attention to the decision makers and the policy makers that the curriculum for the pre-med pathway needs a significant overhaul in that case, because the
Yeah.
criteria remains the same as it has been for decades ago. And so to to kind of expand on this point further, Dr. Sana, because that is a significant number of our audience today who is in this boat. I know you've mentioned science fairs and so on, but how can students start exploring the intersection of medicine and AI while still in high school? Please keep in mind, there are very few high schools that are registered to take part in the National Science and Engineering Fair, unlike, once again, the United States, where almost every other high school is registered to do so. Um, how can students take the initiative to build these skills? I would also, say to take an AI course, but I'm gonna like pin you down a little bit
Yeah,
more.
yeah, yeah.
Oh,
You don't have to pin me down at all. The answer is
good.
actually very clear. Ask AI.
Oh,
Look,
ChatGPT is your friend.
absolutely. And I mean, you got ChatGPT, you got Grok, you got several of these already. Mashallah, they're out there. Um, I would say put your information in there. Say, listen, I'm an 18 years old, male student, pre med in Lahore. this background, to actually talk to it and say that, how can I start exploring intersection of medicine and AI? I'm in high school, and I'll tell you, it will actually customize for you, and it will tell you what courses are available, which will be optimal for you. And if you're in the future interested in psychiatry, perhaps, or if you want to go in orthopedic surgery, tell it that. And because it's for me to try to give you an answer for this question, it's too broad based of a question, but the answer is also very narrow to say, you know what? Ask AI how you can learn about it and implement it in medicine.
Got it. This leads me to my next segment of questions of AI in practice.
Okay.
And can you share an example where AI has already improved patient outcomes or diagnostic accuracy in your field? You have mentioned in your own field in radiology, it is something that AI is doing. Um, can you expand a little bit more on it?
Yeah, yeah. I already experienced it, right? So our AI systems are basically um, are able to detect subtle findings on medical imaging that might otherwise be overlooked. And so essentially improving diagnostic accuracy. And keep in mind, right, we're still as human as we are. I can tell you right now that when I start in the morning and start reading images to when I'm reading the same images in the evening. Sorry to say, but I mean, I am definitely much more tired by the time the later part of the day comes around, or maybe postprandial, after lunch. Uh, so believe it or not, it really actually helps a lot and gives me a lot more confidence as well. In that sense. So yes, so whether it's in radiology, whether it's pathology, even and keep in mind, right, when I said family practice to you earlier, internal medicine is also going to be affected by AI. People are like, well, how is that the case? You have to keep in mind that, what are those doctors doing? They're basically gathering information, gathering data, and then, based on the outcomes of the results, then go down certain pathways of decision making, right? So, yeah,
Mhm.
AI can do that, and it will do that, and it'll actually help us prevent potentially overlooking things that are more subtle that we might have, missed or not otherwise realized. So, yep, I experience this all the time in my practice. So, in radiology for sure, it helps significantly.
Okay. And what are some common misconceptions students have about AI in medicine?
As I mentioned this earlier, Sanjay. I think sometimes people think that AI is going to replace the doctor. I don't ascribe to it. I don't believe that that's going to be the case. I always say this: it's not AI that's going to replace the job. It's the person who learns AI that's going to take your job.
So, this is a very real fear. This is a question I get very often now from parents, Dr. Sana.
Hmm.
Should, should my child even be doing medicine if AI is going to be replacing medicine? This is a comment, a question I hear over and over again. And as a non-medical person, I I
Yeah.
hear various things, and I find it interesting when you say that medicine is going to remain a field where humans are still going to play a critical role, if I'm hearing you right, except AI is now going to be more and more embedded in it.
Yes.
Um,
Okay.
so, yeah.
Your question should not be limited to medicine, Shanzeh. That same question can be asked about pretty much any field, right? I mean,
Yeah.
you're saying the parents are fearing, should my child go into medicine because AI is going to be so prevalent in it? Well, then should that parent who's sending their child to computer engineering ask the same question? Should this is the parent sending the child to, chemistry ask the same question? Um, right? I mean, where is AI not going to infiltrate? So my answer to that question, I'll tell you, is that your child, my child, any young person, I should take it as not being a child necessarily, should go into a field where they really, really enjoy being. Okay. So if you like to work with people and see people get healthy, coming back from diseases, you want to be empathetic with people, then of course you should go into medicine because you enjoy it. So whatever it is that you're going to do, and I know it sounds cliche-ish to say go into what you really enjoy, that's this truth is the best truth of the AI world. That is, students should go into the fields that they really, really, really enjoy being at. Okay, if you want to go into medicine to make money, only if that's your reason, then you're really going in the wrong place because it takes still significant amount of effort to become a physician or become a doctor and memorizing things and spending time. And but if you really enjoy it, I have to tell you, I had so much more. I had more fun in medical school than I did before or after, because I really, really enjoyed learning, and I really enjoyed, with patients and being with other physicians and learning from my seniors, and it just, it was, I just really enjoyed it. So yeah, would I do it all over again? I would because it really was, it was fun. For me, and, of course, it's not like all fun. You're still studying and stuff, so my answer to this question, it is a very important question, is that make sure if you're a parent, check with your child as to what is it that they really like to do. What is their superpower, and send them in that arena because otherwise they'll be not just miserable, they really will be spending a lot of time and get replaced by someone who uses AI and enjoys it. How's that for a long-winded answer to a short question?
No, I think that's very insightful. I actually saw, and I was kind of scrolling up and down, people were raising their hands, and I'm sorry, I should have in housekeeping mentioned earlier. Everyone, I know we all want to take advantage of Dr. Sana's presence. Please put all your questions in the chat box. I will be in another 5 minutes asking your questions to Dr. Sana directly. So please go ahead, any questions you have,
Okay.
and go ahead and put your questions in the chat box. We will be getting to your questions in 5 minutes time. So Dr. Sana, on this, what limitations does AI still face in clinical settings today? Uh, it seems we may have lost our guest for just a minute. Oh, no, he's here. We lost his video. Dr. Sana, are you there? You're on mute, Dr. Sana. Um, Audience, please bear with us for a slight technical delay. Dr. Sana, you are on
Okay.
mute.
How about
There
that?
we have you.
You got
Uh,
me back.
yes, I'll just repeat my question. It's the last one I'm going to throw your way before we take questions from the audience.
Yeah.
What limitations does AI still face in clinical settings today?
Okay. So today I can tell you the biggest struggle AI has today is incomplete data. No question about it. Because we are still the ones that are generating the data. And, sometimes I guess there's this saying, right? Garbage in, garbage out. So if AI is not getting the full set of data, and it's kind of interesting because we as humans, sometimes we tend to spoon feed it small amount of information at a time versus giving it, all aspects. That's what I mean by when I talk about vibing with AI. If you say this patient has these lab results, but you don't say the patient is 33-year-old male, it's going to go down a different path because if it doesn't know the age of the patient, and we tend to sometimes leave that out in our communication with AI. If there's unusual cases, um, sometimes it can struggle. Um, but also, I think AI struggles often with contextual understanding. So, like, because we don't give it the right context, it struggles with it because of the sort of the humanness of it, you know. Um, Perhaps another place I would say, I still think that humans have some nuanced judgment that AI potentially can, because it's interesting because I know doctors that often they actually will look at a patient and then ask the patient, you know, hey, have you been thirsty more recently? Because they noticed a little crack on their lip, which never got reported by the patient in the history or
Mm.
by, you know, somebody. You see what I'm saying? So whereas the
Yeah,
doctor looks at it and has this nuance and say, hey, wait a minute, you know, because they notice a little crack, they might ask about it. AI wouldn't necessarily do that. You see what I'm saying? So there's
right, right.
some these kind of nuance. So I think there is limitations from that perspective. And again, I really like to make sure that human stays in the loop of this because of these situations.
It's going to be a big relief to uh, for all of us who are grappling with these kinds of issues. So audience, feel free to I did see hands being raised. Please drop your question in the chat box, and I will convey it to Dr. Sana. So Dr. Sana, one of the questions we have received is, how can future doctors maintain a strong human connection with patients when AI handles more of the diagnostic process?
Oh, in fact, that's an advantage, right? Because instead of somebody sitting there and trying to figure out all of the details of the lab results and its nuances, if that is done for you, you in fact can actually sit there with the patient, focused on the patient, perhaps holding their hand, holding their shoulder, looking them and not worried about, you know, oh, did I miss it? Did I miss that in the data set? You see what I'm saying? It's actually the answer. The question is really a good one, but in fact, that is the advantage of AI when you're in, you know, when you're in sync with it for your patient's treatment. Because now, Shantya, believe it or not, even this to this day, before I start a procedure, anytime before I do a procedure in my clinic or my practice, I actually never get to my procedure right away. I literally sit there with a patient, just say, how are you doing? What's been going on in your day? Where did you just drive in from? Oh wow, that's pretty far. Did you get bad traffic? Right. You see that human connect makes a
Yes,
huge
yes.
difference. And my my chief tech always says to me, it's like she always telling me, she's like, I work with so many doctors in the clinics, but your patients almost always like they always like leave happy and they seem to be in less pain. So I'm doing the same procedure, but I believe it or not, when you take some time with your patients, it changes their feeling about that experience that they're having. AI will allow you to do that as a doctor and feel confident that you didn't miss something that was nuanced.
No, thank you for that.
Yeah.
Um, Quite a few questions coming in. Who is legally and ethically responsible when an AI diagnostic tool makes an error that impacts patient care, Dr. Sana?
Yeah.
I'm sure very pertinent, particularly in
Yes.
the United States.
So that's really a great question from the perspective of the, yeah, I guess the United States or any state, I suppose. At this current moment, everything still falls back onto the human physician. Now, it may not necessarily be the case, I suppose, in the future, because we're right now, you know, we have self-driving cars in the United States, right? So I have a Tesla that actually takes me from point A to point B without me having to do anything. And so the question will be: is if that car gets in an accident, who's actually responsible? The way the legislation is written currently, I still am the owner of that car, and I'm still responsible. So answer to your question at this moment in time is that it's still the human physician that's going to be ultimately responsible for if even if they use AI, they're still responsible if the AI makes a mistake.
And what ethical concerns are associated with AI and in medicine?
Oh boy.
Have I opened a can of worms, Dr. Sana?
It is a can of worms, right? Because you know, uh, Wow. I mean, you know, just medicine in general, Shanze, there's so many ethical, it's not just AI. I mean, we're talking about genetic engineering that's happening right now, right? DNA splicing and potentially even selecting the gender of your child and the color of their eye color before they're born. I mean, I don't even know how to answer that question because it's such a broad-based, it's a great question, but it's so broad-based. The ethical issues in medicine are going to be so diverse and common with how things are advancing, right? So I don't know. I honestly don't even know how to like address all of that. And there are um, there are philosophers that are actually addressing this question right now and trying to figure out from human psychology how do we adapt, right? Um, so, on the other hand, if I want to go on the positive side of things, you know, if a doctor can become much more efficient and if AI can help them recognize who in the ER is much more emergent than another, or who is, you know, like I've been in, like, you know, if you go to some of the hospitals here in Pakistan, even in the US is similar, but in Pakistan, I've seen lines outside of the hospital,
Yeah,
literally like lines outside of the ERs, right? Um, so if AI could actually identify the emergence, the true emergent cases in that line and the not so emergent cases, that will help in itself, right? So yes, so
yeah,
it'll bring up ethical issues, but it also potentially save lives and make the doctor's job a lot easier to do. It just all depends on, you know, how we utilize it, I suppose, you know?
sure. Audience, please once again feel free to drop in your questions. We'll try to get to as many as we can before our close at 7 o'clock. But to continue, Dr. Sana, how can we ensure that the data used to train medical AI models does not introduce bias against minority patient populations?
Yeah, it already does, right? If you think about the cholesterol levels that we call normal, okay? Um, I'm sorry, but they're all based out of European and American studies. So we are all normal compared to, you know, your average white male of 35 years of age. So, right? Now, having said that, uh, it's very interesting because currently there are projects going on in Pakistan. And in fact, some of my Pakistani American physicians are doing it here, that they're trying to really massively collect on data from here and doing the studies off of here. So the question is actually, again, your audience is asking excellent questions also, right? Because yes, these data sets that tell us what the normative value should be are coming from a select group of people, and we do really need to re-evaluate all of that. AI will actually help a lot because AI can do a lot of data analysis in itself, right? So we can go into and say, okay, listen, even it can go from, let's just say, from Lahore versus Karachi versus Gujarat versus Hyderabad. It will be able to do the analytics actually much more quicker than we as human beings can do and collect. So I think it'll help in that realm. But it's a great question. And the answer is that those studies do need to be done because otherwise we do bias the data.
Yeah. It looks like a current medical student or maybe a pre-med student has asked this question, but how will AI change the daily workflow and routine of a residency program in the next 5 years? I don't even know what a typical workflow is, so I don't know how AI is going to impact it.
Well, the typical workflow for a resident, right? They come in really early in the morning. They do their rounds before the attendings get there. They gather all of the data. They make sure all the lab results are in. They actually do the analyze the results. They try to figure out, okay, what's the diagnosis in this patient. So when I do the presentation to the attending, they will know that I've done a complete workup. The attending doesn't have to do that much work. So otherwise, a doctor would have to gather all that himself or herself, right? And then do all the analysis. So in a residency program, the residents, you know, you have the medical students, then you have the interns, then you have the residents, and you have the fellows, and you have the, you know, sitting on top of the the attendings, right?
But a
Um,
doctor.
I like being on the attending side of the fence right now, so it's much better.
Okay.
But I think that what it will do is um, it will actually make it much more efficient, right? So it'll allow a resident to be more thorough on their patient. It allow the resident to actually learn more because sort of हम लोग पागलों की तरह फिरते हैं in the morning, okay? I'm serious. As a resident, you're just, you got yourself these 15 patients and you got to like gather up all the information and you got to do the analysis and stuff. Which if that part, you'll become more like almost like a senior resident or an attending at a junior level because that work will be done for you. So you can then learn a lot more from what what it's showing you and telling you, and then again spend that time with the patient, be able to, you know, um, befriend the patient really, and I mean that really. I think as physicians we tend to be very quick and in and out of the rooms and stuff, and it really leaves people hanging and not and feeling very vulnerable. So I think it's much it'll allow the residents to be more efficient and allow them to be to learn more. So
Somebody's kind of following up on one of the conversations we were having earlier on medical school curriculums.
mm,
And they're asking, will medical school curriculums change soon to include mandatory classes on AI data science and machine learning? I don't know whether this question is, I'm assuming it's from a Pakistani student. So I,
mm.
I don't know if that's happening here. But has it happened in the United States, Dr. Sana?
It has already. I'm going to be speaking with tomorrow with the Secretary of Health,
Oh,
Pakistan's
okay.
Secretary of Health. Um, I'm going to ask that question that your student just asked, because if it isn't being implemented, then it needs to be. I have to also tell you, not no disrespect to the elders, but sometimes our elders hold us back. And if that is what the medical students are seeing and feeling, they should demand, they should take poster boards and protest. And what?
Dr.
Am
Sana,
I
are you
starting a revolution?
inciting rebellion over
Rebel.
here?
It's only for the good of not just the students, but the patients of Pakistan.
Point
Okay?
point taken. I'm sure your
Yeah.
message is
But
conveyed, but I
whoever's
think
listening
talking
to
to the
this,
health secretary would be another another way to do this.
yes,
Uh,
yes, I am actually talking to him tomorrow, so I will bring it up. I don't know the answer to that question because I'm not in the medical school, environment here. Uh,
yeah,
if but let me find out because if not, I can definitely get them the curriculum what's being taught in the United States top universities.
I think that would
Um,
be an invaluable contribution, Dr.
yeah,
Sun,
yeah,
to
yeah, happy to do
um,
that. Absolutely, absolutely.
and I think this is probably a teacher or lecturer who's asked this question. What is your advice for explaining AI-driven diagnosis to patients or practitioner who may be skeptical of the technology? So yes, this is Pakistan,
Uh-huh.
Dr. Sana, and
Hmm.
our audience, as you mentioned, some of them may be elders, some of them may be old-fashioned, some of them may not want to rely on AI. So should the doctor in question just omit that they have taken that kind of assistance altogether?
So the question is whether the patient is being resistant to that kind of information or
Yeah,
is the
I
doctor
I
being
I I
deficient,
feel like that's
Uh,
what is being asked. What is your advice for explaining AI-driven diagnosis to patients who may be skeptical of the technology? So I guess not tell them.
yeah. Yeah. So I tell you right now, I will say that patients just want to get well. When you're sick, you want to get well. And if it's AI that's getting you well, if it's a robotic surgeon that gets you well, if it's, ultimately that's the case. Now, I have actually seen, particularly in Umrah time, I know how does Umrah relate to all of this stuff? I've seen elderly standing at the escalator and not wanting to get on because they see the escalator moving automatically down,
Yeah.
and they are really fearful to getting on, and they just are frozen, and a whole bunch of people behind them and saying chalo 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 kya kar rahe ho chalo, right? And but they, because they're frozen, they can't, because it's the technology they haven't experienced, haven't seen, right? So when someone holds their hand, and that's what happens all the time, कि माँ जी मैं आपका हाथ पकड़ लिया, अब्बा मैं आपका हाथ पकड़ लूं, they hold them, they feel secure with the person, then they have them hold the railing, and as the escalators goes down, somebody's holding their hand and they're holding on to the side. I think the patients have to be done the same way. Really hold their hand, be kind to them, explain, still be the doctor to say, oh, you know, हम देखिए ये tools use कर रहे हैं आजकल, नई technology आ गई है, and in this technology, it's really helping us, to diagnose things better. Ease them in. Now, more important question is that elder doctor that's afraid to use it.
Mm.
That will also be the case. The elder professor that's afraid to use or tell the students to use AI because he or she himself or herself is not comfortable using AI, right? So anytime there's change, Shanze, there's anxiety that comes with change in anything, not just this,
Yeah.
right? Uncertainties and stuff, and you feel really strained. And so just know that it's coming, but we have to be patient with each other. Those that know, that learn, should be patient and teach that are those that are afraid of it and fearful a little bit. If we use it the right way, AI is going to do miracles for our and doctors wise, or for our patients. Um, and almost in anything, it's going to do miracles in farming. You're going to have drones that are going to be flying around, making sure the crops are not infected. They're going to check to make sure that the soil is perfectly watered, right? The fertilizer is the right amount. That so that field produces 2 or 3 times what it would otherwise. Um, I'm just giving an example of, like, how this is going to be potentially so much better. A doctor will be able. There's a massive shortage of doctors. I know they think, oh, Pakistan, we need a doctor, but you know how many doctors there are in the villages? How much
Yeah.
healthcare is being done
Yeah.
there?
People don't want to go to rural areas. There's a big shortage.
Big shortage, right? So you bring somebody from there, get them to vibe with the AI, so they can actually go there and utilize AI agents to have right diagnosis for the patients that are there.
Yeah.
We have way, way, way too much shortage of doctors in Pakistan for the 250 million people that are here.
Yeah.
You can't produce doctors fast enough as fast as the population is increasing,
True.
right?
Um, I I want to touch on one segment of your bio that we simply have not, Dr. Sana, which I also think is very, very unique, is that you have combined medicine research and entrepreneurship. It's a very rare combination. We have a lot of very qualified doctors in Pakistan, but this unique combination of medicine research and entrepreneurship is just amazing. What advice would you give students who want to build healthcare startups in the future?
Oh my gosh. So there's the term entrepreneur, right?
Yeah,
Everybody
yeah.
talks about entrepreneur. So first, I think you should really pronounce this enter to be poor. Okay. Uh, so entrepreneurship really is that you kind of have to just really love what you're doing and be prepared to be uh, you know to be poor for a while, because when you talk about research, all right, when you talk about entrepreneur, so you're right, like, academics, research, entrepreneurship isn't, it is somewhat of a unique, it's a combination that is not that commonly found, and it's probably because there's always a fear factor, right? When you're going to start something new, or you're going to go start your own business, or if you're going to start some new product lines, you don't know. It's the unknown that often holds people back. Doctors, particularly, tend to be much more rigid in terms of what's predictable.
Hmm.
So, uh, because they're trained, right? कि इस तरह करोगे तो ये होगा, इस तरह करोगे तो ये-" right? So it's like, and in the US, it's even worse because they're, if you do something new and you make a mistake, you're going to get sued. And if you get sued, then what do you fall back on? Right? Because as a doctor, you want to fall back on the fact, hey, this is the research paper, this is published, this is, this is what they're teaching us in the books. So you can fall back in front of a jury to say this. But if you're a trailblazer, then what do you fall back on? Right? So, so that's where you have to be a little cautious. So you mentioned something earlier, which was the stand-up MRIs, because it's like, what the heck is that, a weight bearing? So what was it with that? So I'll tell you, right, as a radiologist, I always felt that this whole concept of laying the patient down every time you do an MRI is a problem, because if I come to you and say, Dr. Shanza, my back hurts when I bend, like right here, you said that, why would you image me laying down?
Ah, I
I'm
see.
not right. I'm not telling you I'm hurting when I'm laying down. I'm telling you I'm really hurting. I'm a tennis player and I go to serve, and it hurts when I raise my arm. That's where the rotator cuff tear is going to show up, not in the position down here, right?
Yeah.
So, with that thought in mind, and with obviously I have my PhD degrees, right, and along with the MD, so that's where I really got involved with this whole concept of vertical placement of magnets, people being able to sit or stand or flex and extend because there's nothing in front of the patient. So you can do movement MRIs on the patients. So yes, that's entrepreneurship with science, right? With technology. Uh, but it was something that you see a problem, you say, well, can I solve this problem? I solved the problem and then made a business out of it as an outcome of it. So most of my business is an outcome of my science, you know?
Sure. Absolutely. I mean, I think that's the key to any successful entrepreneurial journey is you
Yeah.
identify a problem and solve it. Our audience likes that answer. What and on this, Dr. Sana, on this note, it's a very difficult journey. What inspired you to pursue both an MD and a PhD? And would you make that same decision today?
Oh, absolutely. I have to tell you one thing though. My PhD was much harder than my MD. Uh, the MD degree, pretty much, they tell you what courses to take, and you pass them, and you get your degree. With the PhD, the problem is you could be doing research for 2 years, and then the results finally start to come out, and they're wrong or they're erroneous, and you're stuck and they just start all over again. So, and you're doing something that no one's done before. That's the whole idea. Otherwise your PhD thesis is useless if it's somebody already done it. So so the other answer to the question is, why do both? uh, they're distinct methodologies of actually solving problems, whereas doctors are like very regimented in their pathways of, it's a flowchart based decision making tree, whereas a scientist is almost always thinking outside the box and coming at it from a different direction. So, and most people actually don't know this, but I also did a training in pathology, so
Okay.
residency training. So now when I look at a problem, I look at it from radiology, imaging, pathology, actually what the tissue looks like, anatomy, and then the physiology. So it's like I come from four different angles to look at that problem, right?
Um, Dr. Sarah, when did you get done with school?
When did I get done?
Yes.
I when I graduated, I was 27.
Mashallah.
Yeah.
Um, and I think this would pertain to, I can see some of my students in the audience, and I know I'm going to ask you to rewind a few decades, but what influenced you to go down this career path? Like,
Oh.
and especially, and I'm going to be very honest, and
uh,
I want an honest answer, Dr. Sana. We are
yes.
coming towards the end of our, end of our
Uh,
session. People, there are typically two answers on why I want to be a doctor.
uh,
Want to make money, number one.
mm,
That's usually what I hear. Number
yeah.
two is, which I think was more for perhaps your generation than the one I deal with. I want to serve. So what experiences influenced your career path? And as a wrap up, we have to close. What would be the one piece of advice to every
Um,
student interested in medicine? What would you
uh,
tell? These,
Okay, so since we're talking about honest answers, honest questions, none of that stuff was. It was my sixth grade teacher that told my parents that Sana is very smart, and you should consider making him a doctor. And especially because I was really good at my biology and physiology. I mean, very sixth grade level, but he just thought I was really good at it. Um, and that was it, Shanze. It wasn't like I had some big epiphany that all of a sudden I was helping this poor person in danger and I felt so amazed by it and I want to become a doctor. The reason I was laughing was because seriously, it was my sixth grade teacher, Dr. Lord, Mr. Lord, who told my parents, "Bachcho ko doctor banao." You tell Pakistani parents, "Bachche ko doctor banao." End of that discussion. So I was destined to be a physician. Now I will tell you that had my parents not told me from that early childhood that you're going to be a doctor, it is very likely that I would have gone into computer sciences and software engineering, because in high school that actually was my favorite subject. I really, really enjoyed, and I'm talking 1982. And so that's when computers and programming was just basically coming out, right? And I really enjoyed it. I very likely would have gone into it. On the other hand, radiology is the technology field of medicine. So I suppose in a way, I ended up in the programming aspect of medicine, which I still do because with programming sequencing and things like that. But sorry, I know it's not as fun of an answer as you thought.
Biotech did not strike you. So we can feel, the parents in Pakistan can feel happy with the takeaway. We can tell our kid what to do, and it all worked out. Okay, that
All right.
works. We'll run with it. And your advice as we close to the pre-med students listening in today, what would you tell them?
So I would tell you, please, please, please don't do it for money's sake. And it's more so true now in the age of AI than any time before. Okay. Uh, Please do really enjoy it. And if you really enjoy working with people, healing, being part of the healing process, the satisfaction that you feel, the love of it that you feel. And I mean that. I know it sounds so cliche ish, but it's really true, because you're going to spend the next, 10, 12 years learning a lot of information in minutia, but learn to serve. Money will come. पैसे तो बनेगा. I honestly बताऊं, पैसे तो अल्लाह ने रिस्क लिखा हुआ है, and I really truly believe that will come. Um, how it will come to you is up to you. So if you do it, but for caring for people, for the love of people, taking care of them, आपके जो किस्मत में लिखा है अल्लाह देगा और उसके साथ साथ सवाब भी देता रहेगा आपको, But if you do it for the sake of just money, then you're going to be going from one room to the next room to the next room to the restroom, next room, and people are just asking for their checks, and end of the day, you're going to get replaced by AI.
Well, thank you so much for your time today, Dr. Sana, and for your valuable words of advice. It was an honor and privilege
No,
for us to have this time with you. So we are very, very grateful. And I'm sure that the audience today has had some important takeaways. Thank you so much for joining us today,
uh,
everyone.
my
And
blessing. It's always my blessing. Thank you for having me.
thank you, Jay.
Thank you.
Khudafis, folks,
Okay.
and good evening from us here at Ion Ivy. Bye bye, everyone.